And our next speaker I'd like to introduce is Dr. Irwin Redlener. Dr. Redlener is a professor of clinical public health and director of the National Center for Disaster Preparedness at Columbia University's Mailman School of Public Health. Dr. Redlener speaks and writes extensively on disaster preparedness policies, pandemic influenza, and the threat of terrorism in the U.S., as well as the impact and consequences of natural disasters and related issues. Throughout his career, he has worked on various issues in various locations, including projects in Honduras, Guatemala, Ethiopia, and the Sudan. Dr. Redlener is a pediatrician, and he's worked extensively in the Gulf region following Hurricane Katrina, where he helped establish ongoing medical public health programs. He also organized medical response teams in the immediate aftermath of the World Trade Center attacks on 9/11, and following Hurricane Andrew in South Florida, as well as other international management leadership experiences. He's the author of the book Americans at Risk: Why We Are Not Prepared for Mega Disasters and What We Can Do Now, published in August of 2006 by Alfred A. Knopf. Dr. Redlener also is president and co-founder of the Children's Health Fund and has extensive experience in healthcare systems, crisis response, and public policy with respect to access to healthcare for underserved populations, particularly children. Dr. Redlener served as one of the 10 members of the congressionally established National Commission on Children in Disasters. And Dr. Redlener is here today to talk about the extraordinary consequences of large-scale evacuations. So welcome, Dr. Redlener.
Planning and organization as formal processes. And I think we really actually need both to happen. We need the effective response to a disaster, including evacuation, requires a tremendous amount of capacity of individuals to respond appropriately at the scene and on time, at the time. There was no shortage of heroism in the Gulf after Katrina, or Hurricane Andrew in Florida after Hurricane Andrew hit and destroyed a lot of South Florida. The problem is that heroism, in the absence of organization or in the presence of disorganized or dysfunctional government policies, is itself not enough. You can't have enough individual heroism to overcome extraordinary, serious lack of needed resources. You know, you either have it or you don't have it. You've thought about it before, or you haven't thought about it before. If you forget to put cribs and diapers in shelters where a lot of children are going to, young families are going to be, you know, you're just not going to get enough volunteers that are going to risk their lives to get, you know, Pampers for kids that are now in a shelter for a while. So I just want to emphasize the point that it's just like we need to say that private sector assets and resources need to be very well understood and part of the planning process to supplement what government's able to do. We also have to be able to expect that the heroism that we see in these situations, and it was just absolutely remarkable what happened after 9/11, is accompanied by appropriate deployment of public resources and pre-disaster planning. But I'm going to come back to some of this in a little bit. What I want to try to do is give an overview of evacuation from the perspective of the consequences for human beings who are involved in either deploying or developing an evacuation, or those who are being evacuated. And I just want to say something about what we're aiming to do here, because the overall goal of the effort, of the initiative of evacuation, has to be somehow defined. So we're talking about the effective, efficient movement of a population that out of harm's way, that is the disaster, to a hopefully temporary safe haven, which is the destination. So how we're able to accomplish this goal and what are the barriers which impede our ability to get from A to B is really what I'd like to chat with you about. And I'm going to frame this by talking about 7 particular principles or issues that I think contribute to a more complete understanding of what is actually happening and what we need to think about. And then I'd like to leave enough time for some discussion with all of you at the end of this. First of all, and some of this goes without saying. Not all disasters obviously require an evacuation. So some disasters require very rapid evacuation, and some require no evacuation at all. So just to reinforce this point, in the event of a large-scale pandemic, for instance, where the thing is happening everywhere, you don't want to be going from one area of pandemic to another area of pandemic where infection rates are just as high. So for some things, you're just going to be where you are, so that the disaster response planning has to do with creating zones of safety and resilience within the place that's being struck. So this is just an old picture of a pandemic reaction a long, long time ago. But the point I want to make is not everything requires movement of people. The second thing is that, in general, myself personally and professionally, and my center's work, and to some degree what I'm going to talk about with respect to evacuations, is that I don't think we're too worried about how we are able to respond to small disasters or large-scale emergencies, or short evacuations of people from particular circumstances. Because these kinds of events we're increasingly good at as a society, and we're good at it across the board. Towns upstate New York or in the middle of Louisiana have enough practice and experience, enough awareness now that if there's a major fire or there's local flooding, that the local officials and local individuals can pretty much handle those things. But as we creep up the scale towards larger and larger situations, our competency, our effectiveness, our understanding about dynamics tends to diminish. So the challenge that I'm describing here is how we do or don't respond effectively to the management of mega disasters and the management and planning for very large-scale, long-term evacuations. I just need to then define what I mean by mega disaster, so we're all more or less on the same page. And this is something this is our own working definition of it. I don't think it's in Webster's, but just to make sure that we're understanding each other about what we're talking about. So what's a mega disaster? We define it as a catastrophic, very high consequence event that, and this is irrespective of ideology, whether it's terrorism or a Katrina or something else, whatever it is, that event, if it overwhelms or is threatening to overwhelm local and regional ability to respond effectively, that is what in our minds comprise the elements of a mega disaster. And specifically, what we're talking about here, and the first thing, this is in more or less priority order about a mega disaster. So if the thing happens and the local authorities and officials and individuals are unable to manage the immediate rescue of endangered survivors, that you already now are superseding the local capacity, and we're in some trouble that we need to think about in terms of this being something more than just a large-scale emergency. The second thing is if we can in fact rescue people, if we're pulling people out of the rubble effectively, as fast and as effectively as we can in an earthquake, but then we don't have the medical response capacity to be able to manage the survival of those individuals. Now, don't forget, I'm coming at this from a physician and public health point of view. So if we pull people out and can't save them once rescued, we need a lot of outside resources. It's a second indicator that we're dealing with something in megaland here. And a great example of it's an extreme example is the earthquake in Haiti a couple of years ago, and many of us were out there saying you have a 72-hour window to extract people from the rubble. If you can't do it by then, you're going to see a dramatic, very rapid, exponentially rapid rise in fatalities because that's what the timeline is. The longer it takes to affect that rescue, the greater the fatality rates. Is something we obviously need to worry about. The third characteristic of a mega disaster is the inability to prevent serious damage to vital infrastructure. or significant property destruction. And finally, uncontrolled societal breakdown, which happens very, very rarely. But these basically represent those elements of the thing that I'm defining as a mega disaster, which is really what I want to focus on as I continue through my remarks. The third thing is, and I think Jim made this point in a number of different ways, is that every major disaster is itself a unique situation. There is no prototype that is replicated with the next hurricane, the next earthquake, or whatever it is. And there are too many individual factors that make disasters fundamentally idiosyncratic. So that is one of the reasons that we have to be able to plan generically with some conditions that I'm going to get back to, but be able to act very specifically. And that's really what happens in these episodes, these many, many instances of heroism, where people are making individual on-the-ground decisions, where they're breaking those rules that you talked about, Jim, where they're saying, yeah, I know I'm not supposed to take more than 5 people on this vessel, but I'm taking 15 because I need to, and that's what the situation calls for. But the situations are, as I say, inherently variable, and sometimes in the extreme from one situation to the other. So when we try to relate this point to evacuation planning, we have to very much keep in mind that we'll still need to leave a room for the creative reaction to situations as they come up that may have been very, very unpredictable in the extreme. So a nuclear power plant accident, for instance, has certain characteristics associated with it that make it fundamentally different from other kinds of disasters. How quickly people need to be evacuated, where they need to go, when they can come back. And these are things I'm going to delineate more specifically. But that's a very, very different situation than a detonation of an improvised nuclear device, an atomic or nuclear weapon exploded by a terrorist in a major city is very, very different, clearly. I know I don't have to hammer this with you, than would be a nuclear power plant catastrophe, and that very different from a dirty bomb. So these are all things that are radiation related, but entirely different in terms of how we plan for responding, how we prevent them in the first place, and then how and why and what we do about evacuation of populations that may be affected by these various events here. Large-scale releases of chemicals, a different set of scenarios, a different sense of timeline. How long is the area going to be contaminated? How easy is it to rescue people under these circumstances? What exactly needs to happen as we're getting ready to evacuate? Tsunami, again, very, very different. That the evacuation from a tsunami warning, and you can get some warning that a tsunami is coming. You measure it in minutes, but are we able to rapidly evacuate people and have people self-evacuate is more accurate in the face of a tsunami that's going to hit in 15 minutes or so. So this is a different kind of challenge. So the setup for effective evacuation under circumstances like a big tsunami, again, very different. And by the way, the west coast of the United States is in fact subject to a tsunami. Will we get it? Nobody knows. And in fact, trying to understand the probabilities of various kinds of large-scale disasters is essentially almost impossible, especially for unique events where there's no history to give us some sense. So we know, for instance, that a pandemic happens about 3 times a century. We have no idea how to compare that to the likelihood of nuclear terrorism, for instance, since we really have not had that. An earthquake, again, what about the earthquake do we need to know in terms of planning for large-scale evacuations? Well, it depends on where the earthquake is. If it's Northridge in California, that's one thing. If it's downtown Manhattan, I realized just actually very recently that there's a seismically potentially active zone on 125th Street in Manhattan where my office is. There you go. So the New Madrid seismic zone is massive. People don't quite realize in many cases, certainly in terms of the general population, that they're living in earthquake-prone zones. So the question is, are there people getting ready in Memphis, for instance, for how we'd evacuate a population there, and not going all that well? flooding, as people have experienced here, is again remarkable, very consequential, but also very unpredictable about how much flooding needs to be predicted before you have evacuation versus taking other local measures that keep you safe without having to do mass population movements. And obviously, a situation as massive as what happened here in 2005 is one set of circumstances. What happens in the Midwest, what happened in Iowa, what happened after Hurricane and Tropical Storm Irene up in the Northeast, all different elements of flooding which demand that we are thinking individually and specifically about the particular circumstances in any of those instances. Volcanoes, again, different. Other kinds of things that we may not even conceive of are possible, but all disasters are unique, and all evacuation plans unique also. You think those are real zombies? I don't think so. So let's talk a little bit about what are the variables which make these idiosyncratic differences among various disasters. And there's two types of variables that or at least I'm artificially categorizing them in two different ways. The first are the general variables. And those would include, first of all, to what extent are the survivors at continuing risk, at persistent risk from the initial hazard or the event. So if there is an earthquake, the buildings collapse, and obviously we're rescuing people from the rubble. There may be aftershocks so that people are at continuing risk to a certain degree, and that has important consequences in terms of driving the speed and the details of the evacuation. If there's a radiological event where there's contamination of an area where there are survivors, those people have to be removed very rapidly from the danger zones. If in the World Trade Center situation, as horrendous as it was, two things about that. One is it was not in a residential community, and number two, it was after those attacks, that was it for that day. Horrible as that day was, but we probably actually had more time than was apparent at the moment to remove people from there. So these are just part of the variables that have to be figured in at the actual time of the event. Is the egress strategy clear? So what I mean here is that if we had if we were worried about planning for an evacuation for another major flood in New Orleans, we can get pretty specific about where we'd want people to go. And therefore, we could plan in more detail the logistics of that movement. If in the case of a nuclear power plant meltdown, let's say, at Indian Point, which is about 35 miles due north of New York City, since we don't know what the many variables will look like, including things like wind direction. What is it going to be prevailing winds, and where are they going, and what direction should we be moving people and how they should get there? We're not going to know that really until the moment that happens, which makes the planning for the egress, the evacuation, far more complicated. We have to have a lot of different options, and we need real-time information to help us figure out exactly what direction we're going in. Thirdly, when you're moving large numbers of people to someplace, are there particular interventions? Is there expertise that needs to be part of the agenda for the destination community? So if I have people with a lot of radiation exposure and I send them to, Middletown, New York, about 60 miles from the city, and nobody in the medical community has a clue about how to diagnose or deal with radiation injuries, that's not a good thing. So what do we have to be thinking about in terms of where people are going? And I'm going to spend some time shortly talking about these destination communities and the challenges that they're facing. But generally speaking, this is just another variable that we're factoring in. This is actually an important point, and has to do with, in large-scale evacuations, with the resistance of the host communities or the destinations to be reluctant to massively resistant in terms of accepting evacuees. So we, for a while, had a place up in a small town in the Berkshires in western Massachusetts, and one day we went up there, and in the weekly newspaper, It was a front page story about how residents of Berkshire County, Massachusetts, were going to take big dump trucks full of sand and dump them on the highways coming into the county, so that in the event of a pandemic flu, so that the outsiders who were infected would not be able to get into the county. It was actually in the newspaper. It made my little hairs curl up, whatever's left of them on the back of my head here. But that is it's sort of an extreme example. But the other reality is that I can totally envision local sheriffs, state police, not necessarily complying with the exiting of 50 or 100,000 New Yorkers fleeing a nuclear event that want to get off at exit 17 on the New York State Thruway to come into Goshen, New York. I can totally see that the local authorities will say, you keep on moving. Now, I'm not saying that necessarily would happen, but if we want to preclude the possibility of that happening, we really do have to spend some time working with whatever the destination communities are to make sure that those things are not likely to happen. Another major general factor is, and this really is germane to the sense of where people are going. So when is safe return likely? So if you have cesium, radioactive cesium contamination from a nuclear power plant to a particular community, nobody's going back there for decades. If you had a nuclear detonation in New York, if you had major destruction of San Francisco from a big earthquake, it's going to be a really, really, really long time, and probably not in our lifetimes, before people can actually come back. We've seen here in New Orleans, the coming back part is actually pretty challenging. And there's things that could be far worse than Katrina that would create factors which would make the return difficult. So if the return's difficult, that makes us have to think differently about where people are going, right? So that if in fact 6 million people from New York City are not going to be able to return for 75 years, that in effect means forever, and that means that we have to be thinking about evacuation in those ways. How much rebuilding will be necessary is related to the previous point. So, yeah, you can come back to the city that's been hit hard by an earthquake, but that's going to require a great deal of planning, thinking, building, and it's going to require a lot of money, a lot of resources, a lot of effort by government and the private sector and so forth to try to make sure that we're able to rebuild rapidly if the plan is to go back. Now, this can be very, very complicated because and clearly the rebuild and the recovery of New Orleans is a big issue. But New Orleans has other problems, as I'm sure. How many of you are from New Orleans? Is this a local crowd here? Yeah, okay. About half of you. All right. So New Orleans, as a city, is experiencing other things, including coastal erosion, rising sea level just from global warming issues, et cetera. Subsidence, which means that the ground underneath the city of New Orleans is actually sinking. So if you have sinking ground, rising sea level, and coastal erosion, and you're not addressing that, then why are people coming back to New Orleans if in 30 or 40 years from now, everybody's going to have to leave New Orleans? So this is very complicated, it's very expensive, and it requires a lot of big thinking about what it is we're trying to do. So these are some of the general factors, but even if we get down to some of the nitty-gritty of evacuating large numbers of people, here's some of the specifics that we need to be thinking about, of course. So evacuation could happen before, during, and or after the actual event has happened. And so the events that have warning associated with it, we clearly want to get people out of harm's way. That's more organized. It can be more directed. It can be more proactive than reactive. If we're evacuating during the disaster itself, when we're dealing with many, many, many immediate life-threatening situations, that the need to put resources into saving lives versus evacuating people. In other words, saving lives that are people about to drown or people crushed by falling buildings. At some point, we run out of resources. Decisions have to be made about where we're putting people to actually help survival. So, so the timing. What was that? Anyone hear that? Is it okay? Okay. A second logistical variable has to do with the type and especially the number of casualties. So if we're trying to evacuate a population with lots and lots of injuries, that's obviously very different than trying to evacuate a population that's basically okay for the moment, and we just got to move them fast. So the medical and public health resources needed in a very significantly mass casualty event, clearly different, and the planning has to be different. And are there enough people to successfully or optimally evacuate people, populations where there are so many injuries? Is the evacuation more or less controlled or more or less chaotic? I think this is really kind of a spectrum. I don't think it's ever totally controlled, and I guess it could be totally chaotic, but hopefully that won't be the case in most of the situations we can think about. But this ability to have a sense of how to have an effective evacuation while things are being kept under control is really important. Are critical supplies available, including water and food and so forth, for the evacuees? And have we thought about the management of vehicular needs? Is there gasoline available? Are there fueling stations effectively available? How have we thought about that in advance? The fourth factor, the fourth issue that I want to discuss is the issue of population vulnerability as it relates to evacuation. I heard the presentations yesterday, which I thought were right on target, and I would want to put an exclamation point on those remarks yesterday, that the evacuation and the response as it relates to so-called vulnerable populations is not a marginal problem. It's a central problem. And one of the things that I really like, of the many things I really like about Administrator Fugate of FEMA, is that he completely gets this. And when we, on the National Commission on Children and Disasters, talked to him about where's the planning for children in disasters, he said it is the plan. It is part of the plan. You can't do a generic plan and then think about children, or do a generic plan and then think about people with disabilities. It is all part of the package, of the community package. And what I'm saying here is that the failure to think about vulnerable populations in the planning process in a central way can become the Achilles heel of evacuation. So if you haven't thought about how you're going to deal with people in nursing homes or homebound elderly or people incarcerated and so forth, those become the issues which can totally undermine and cripple what otherwise might be a reasonable on-paper generic evacuation planning process. So this is not easy. And by the way, one of the reasons that people don't do the things that we think might be logical when we're talking about them in a group like this is because they're very, very hard. It's just hard. So even if you have a job as a head of an Office of Emergency Management, let's say, it's still extraordinarily hard. And basically nobody's prepared to deal with all of the issues that present themselves in planning for response to large-scale or mega disasters. So this question of, are we going to accommodate the needs of children, the elderly, people who are in hospitals, people with disabilities, pets, and so forth. These are human issues which are deeply important in a disaster. And in fact, one of the things that we have to understand is how many of us actually have conditions which make us part of one or more vulnerable groups. And I just want to run through just a couple of these to give you a sense, although I'm sure you understand this. So the 75 million children in the United States, almost 1 in 4 of the population. By the way, let's say, how many of you have school-aged children? Okay. The thing happens like right now, and officials say, you and you are going to get on this bus and we're taking you there. And you have no idea of where your kids are. You have no idea whether your school has the school has a plan to deal with those children. Well, then what? You getting on the bus, or you going to school? I'm going to school. And so, am I going to get shot by a police officer who says, no, you're getting on the bus? What exactly is going to happen? And let me put it this way. If I knew there was a reasonable plan to deal with emergencies and protection of my kids in the school, I might have a chance of getting on the bus, right? If I know that I never thought about this before, I have no idea where my 9-year-old is, in this case my grandchildren, I'm going to have a great deal of difficulty complying with the guidelines and the directions in an evacuation. This is no minor issue. It is no minor issue. A lot of working parents who have concerns about their children, their moms, their people in nursing homes, the next door neighbor. If we haven't thought about it in advance, it's going to be really the weak spot in the evacuation plan and actually could totally undermine it. Anyway, 75 million children in the country. There's 40 million of us over 65. Any of you ever held your own Medicare card? It's a horrifying experience, I'll tell you that. But no, I'm glad to have it, but you know. People with significant chronic illnesses requiring medication or some support, 120 million Americans. People with disabilities, yesterday they talked about, I think, 52 or 54 million, but that includes all ages. So if you take out the children, you take out the seniors, somewhere 22 to 25 million people with significant disabilities in the 21 to 64 age range. 44 million people living in poverty, and that number is rising now during the recession, and will be higher undoubtedly over the next couple of years as well. So people without resources are vulnerable. They don't have the individual capacity to prepare themselves for evacuation and long-term displacement. Undocumented individuals may or may not make their presence known to officials even in the event of a major disaster. There's more than 2 million Americans in prisons, 1.5 million people in nursing homes, and the total vulnerable individuals and vulnerable populations is probably greater than 50% of the U.S. population. Greater than 50%, meaning that this cannot be an afterthought. It has to be the central part of the central thinking about all this. And then there's the hyper-vulnerable, which this is what happened. This is in Japan around the Fukushima event. So, and there was the earthquake, the tsunami, and a lot of people evacuated. This is even before we were starting to really get into the nuclear power plant issues. So you took vulnerable people, in this case, elderly and many elderly ill people, who were vulnerable pre-event, and then you put them chaotically, which is what happened there, in shelters where it was freezing cold. They did not have enough blankets. They couldn't get their medication supplies. So you took a vulnerable population and you exponentially increased vulnerability because of the way the evacuation and the placement of these evacuees was handled. This is something we really want to try to avoid. And in fact, lots of elderly people died as a result of really poor planning of how to handle vulnerable populations. So just a lesson that I hope we learn from. Fifth point is evacuations are clearly local. We have New Orleans and people are going to leave here. It's a local event. But the destinations people are going to are at least regional, if not national. A lot of people went to Texas and Atlanta and really all over the country. The resources to support what has to happen are also local and regional, but there may be a lot of federal resources also needed. So what FEMA has and does, what the Department of Defense has and does, and so forth, what HHS has and applies to the situation are all important. And the only point of this slide is we really have to understand that it does require multi-layer collaboration and cooperation, that large-scale evacuations are not simply the business of the area that's just hit. And I think that's hopefully obvious. But because we don't have an organized system of relating the local, regional, and federal capacities, we get a situation where readiness is pretty random, unfortunately. It's really random. You could just throw a dart at a map of the United States, and are you hitting a place that's ready for large-scale evacuation? Who knows? Maybe not. Because part of the downside of living in a federalist society is there's only so far you can go with national policies. And after that, it's up to states, and some states have a lot of home rule, some states have no home rule. So what you get is, in essence, what we have, which is a hodgepodge of readiness that is an unfortunate characteristic of our country right now. One of the most important things that we have to think about when we're planning for mega disasters generally, and particularly thinking about organizing ourselves to do successful evacuations, is that there is wholesale failure to imagine the scope and scale and complexity of the issues that people are dealing with. And I can't emphasize this enough. I'm going to give you a couple of examples. And this is a matter of the details becoming paramount here. That if you don't think of, and who can think of everything, but if you don't have the planning process able to encourage a significant amount of imagining unfolding scenarios and cascading events, you are undoubtedly going to get tripped up by one or more of these things. So what we need is freewheeling, smart thinking about what could happen. And we can't just eject the hard stuff, because the hard stuff is really what ends up often happening. So I want to take an example of an IND, a nuclear detonation, as I briefly mentioned before. So the first thing is that we're dealing situationally with something that is instantaneously regional. Although ground zero, and this is a model of a detonation, and the details are not important here, but what is important is that in the pink center area there is where there's high degrees of lethality, or high numbers of fatalities from radiation and burns and blunt trauma and so forth. But the consequences are very widespread. This is just the beginning here. So a nuclear detonation is almost by definition a regional event, and obviously in many different kinds of ways of looking at it, a national event. But for the purpose of evacuation and management of a disaster, it's at least regional. Keep this in mind when I come back to the resource question at the end of this. So this is one of the models of a relatively small improvised nuclear device. This is a 10 kiloton detonation hypothesis, which is a little bit less than the bomb we dropped in World War II on Hiroshima. So delayed consequences, 74,000 people with injuries related to this, and expectant deaths, at least 74,000. But we're talking of several hundred thousand people being immediately affected by the consequences of a detonation in Manhattan on a given weekday. And with a relatively small weapon, one that's clearly attainable by an intended smart adversary who would like to do us a lot of harm. So the problem is that the total number of hospital beds in the entire state of New York, including New York City, is less than 40,000 beds, compared to hundreds of thousands of people who are going to need attention, plus the hundreds of thousands who think they need attention but probably don't actually need medical attention. How is it that we're going to accommodate this disparity between the scale of the problem and our capacity to respond? So those 40,000 beds, let's say, are going to be occupied. 85% of them are occupied. And of those, probably 80% cannot be immediately discharged safely. So we have serious disparity between what we have and what we need. Well, what we need here is for the planners of the aftermath of this event to have been thinking about this beforehand. This is one of those issues which is not soluble by individual heroism or innovation or rule breaking. This has to be solved and thought about deeply in advance of the event. We had a modeler named Michael Meat from Chicago help us at a conference that we did a year and a half ago called Day 3, which we specifically wanted to look at what the region looked like after a hypothesized nuclear detonation in Manhattan, but 3 days later, not just the immediate stuff. And so one of the things that Michael Meat did for us was he said, first of all, you could expect New Yorkers to have en masse and probably chaotically evacuated to at least 8 states immediately. So all the surrounding region would be affected by this thing that happened in Midtown Manhattan, in Times Square, let's say. So immediately we'd have people rushing outwards in a probably pretty uncontrolled evacuation. And this slide, you probably can't read it, but, and I don't have a pointer either, but somebody had a pointer, did they? Pointer man to the rescue. It's like, oh, is this yours? Yeah. Okay. Then I shouldn't be putting it in my pocket after he's right. So this one talks about the percentage change in the population of these communities where people are going. So again, you can imagine small towns with quadrupling, quintupling their population all of a sudden with a lot of people who need a lot of stuff. And this is a similar situation, but this is talking about the actual numbers of people descending into different places within the community, within the region rather, as a way of escaping the danger zone. So this is really, really big time consequential for these destination or host communities. These are the 6 areas of the country considered to be the prime potential targets for nuclear terrorism. San Francisco, Los Angeles, Houston, Chicago, Washington, and New York. Not one of these cities or regions, not a single one, has what I would consider to be even barely minimally acceptable plans for dealing with any aspect of nuclear terrorism, from the immediate response to the medical and health needs to the management of the evacuation to what's going to happen in destination communities. Not a single one. And it's unfortunate, and nuclear terrorism is considered one of the 15 disaster planning scenarios that the federal government wishes everybody was paying attention to, but it's kind of hard without resources. And every evacuation, I should say, is a public health challenge or a public health crisis. There is no evacuation that cannot be legitimately looked at through the lens of the public health and health consequences, period. And I'm just going to spend a little bit of time talking about this. So here's what I mean by this. So you're having hundreds of thousands of people leaving a place. And obviously, all the conditions I said in the beginning of this are going to make the variabilities significant. But nonetheless, people are disoriented and they're terrified. Let's just start with that. If it's bad enough that you're going to have to do a mass evacuation, there are going to be psychological consequences that affect people's functioning, their ability to comply, and all sorts of other things which actually can have a consequence for the evacuation itself. Secondly, separation from loved ones and dependents. We talked about that earlier. Again, not a minor issue because a lot of people, and we've done some surveys about this from my national center, simply won't comply. Return uncertainty. So in other words, if I say you're leaving and you have 5 minutes to get your stuff together, you have what you have, and if you have no idea when you're going to be returning, that adds an element of psychological trauma that can be absolutely overwhelming. Fourth, for many evacuees, it is the end of normalcy, period. At least normalcy in the way people knew it before the event. So as we're leaving, as these people are being rushed out of town, what's in their minds is, what's going to happen to me? My world is gone. So these first 4 things represent a spectrum of psychological trauma that under many circumstances is absolutely overwhelming. A lot of people on 9/11 thought it was the beginning of a major assault on the country that would go on for a long time. Just tremendous uncertainty, including loss of pets, loss of possessions, and all that stuff. So that's even before we get to point 7 here, which is injuries, and again, depending on what the event is. So we're evacuating people with trauma and radiation potentially, or burns, and certainly shock. We're evacuating people who are or will shortly be hungry and thirsty, who will experience along the way motor vehicle accidents, MVA. So that these are problems that come from the evacuation itself. So we have now a head-on collision on the exit highway, and we have multiple injuries, and the evacuation stops while that has to be dealt with. We have acute illnesses that may be including, for example, people having a heart attack, or acute respiratory problems, or a CVA, or a cerebral vascular accident, a stroke. So the medical problems, which happen to a population anyway, happen and may be at higher frequency in the population being moved. Complications of chronic diseases. So the diabetic, without insulin develops diabetic ketoacidosis, the DKA there, or severe high blood pressure issues, or whatever else they might have that gets exacerbated by the evacuation. So what we see here, and then of course lack of access to chronic medicines, medicines they need for chronic illness, or other devices, so forth. So what we see here is an array of things that are happening to people that are in a medical and health perspective. So can you plan for an evacuation without having some serious health professional expertise that's going through all this to say, what are we going to do if and when these things happen? And I'm saying here, this is not a menu. In other words, the planners don't get to say, okay, well, we're going to plan for motor vehicle accidents, but we're not going to think about people having strokes or heart attacks on the way out of town. You don't have that choice. The stuff will happen because it's going to happen, and you have to be able to at least have thought about. You can say, there's no way I can figure out how to deal with insulin for people, but at least it has to cross your mind. This is not an option that can be dismissed. The seventh point is this, and my final point, what's my time? I'm okay. So the seventh point I wanted to make here is that this disparity between the needs, if we're honest about the needs, and the resources is actually a far worse problem than it was 2, 3, 4, 5 years ago, because the preparedness budgets, and I'm sure those of you who are in the field know this, are literally shrinking. There's no constituency for sustaining the resources at the level that we need, no less, getting to the resources that we actually need versus sustaining the ones that we had. This is a very, very big problem with serious practical implications. To emphasize this point, I want to go through this little process here, this little exercise. This is the to-do list for host communities receiving evacuees in large numbers. Shelter, obviously. Where are people going to stay? What if it's wintertime? What does that mean for the shelter situation? Sanitation issues. Reliable supply chains, food, water, medications, and all of that, which clearly will get disrupted in the event of many kinds of large-scale disasters. Communications and messaging challenges, public safety, reunification of family members, the medical care that we've talked about a lot already, educational continuity for school-aged children, and daycare, the idea of finding permanent housing if we're going to have a prolonged displacement and really a permanent displacement of people. Economic opportunities. Are people that have been moved from New Orleans going to have a job in wherever it is they're going to? And if not, what is the meaning of that? And how is that going to be handled? Are we going to be able to accommodate language differences and cultural issues which may require special handling? So what we have here is an array of challenges for these small communities who are not even the central point of the disaster. They're the secondary disaster consequences, and who's going to help them figure out how to handle this and where the resource is going to come from. And again, this is not a menu either. You can't say, okay, well, we'll think about the shelter, but we're not going to think about the healthcare needs. Or we're going to think about the shelter and healthcare needs, but I have no idea where people are going to get jobs. Well, you're going to need to, at some point, try to get this figured out. So these are the consequences of large-scale evacuations, and we have to give people the wherewithal to deal with them. So I'm not going to dwell on this, but what this is showing is the tremendous breakdown in funding for preparedness in general and evacuations and regional planning in particular. So 17% overall down from 5 years ago. The Department of Homeland Security and Health and Human Services budgets for planning for and preparing for disasters, and this has had a very terrible impact on individual states and local communities. So it's not just ethereal, distant, federal government thing. This has consequences for local communities. And this slide just shows how many states have had how much of a cutback in their own budgets because of a reduction in the federal resource capacity. Why is this happening? Why? Because the recession is engendering austerity, which some people think it should and probably should. Secondly, there's this sort of the human nature part of this, which is that if I have limited amount of money to spend, I'm going to fix a problem that's actually happening. I'm not going to buy disability insurance for when I'm, 20 years older and I'm disabled and I wish I had the disability insurance. It's a human nature thing. Unfortunately, it manifests itself in government decisions, et cetera. And then I just want to say a word about this last point on the slide here, is that who cares that we're not doing big-time disaster planning and evacuation planning? Where is the locus of outrage that this is going on and no one really knows? So really the choice we have is we need to think big and invest wisely when it comes to disaster planning and evacuation planning, or we're rolling the dice, and sadly, I think that's what we're doing. So, thank you. I would like 200 people to witness the return of the pointer.
So I cannot complain later. Thank you very much. Thank you very much. Hold on. We have a few minutes if we could take a couple of questions. If anybody has any questions for Dr. Redlener in the room, we'll keep to those before we move on to our breakout sessions.
Thanks, Steve.
On that tension that we talked about a little bit earlier of the local experience, that if you had to develop plans for not having life jackets or allowing people to pass, how do you deal with the tension, that laundry list of the breaking of the rules? That is, if you're pre-planned to break rules, that creates a whole local problem with planning, right?
Yeah.
How do you see that working with that?
Well, I guess I would not be a big fan of anticipating rule breaking. I would rather see the rules structured in such a way that it allows flexibility under emergency situations. In other words, as opposed to having a rule that says 100% of the time we're not going to let a baby in a car that doesn't have a car seat, that needs a caveat, except under when a local official or whatever it is decides the situation warrants. In other words, can't we structure the rules to allow the flexibility? I don't think there's a really easy answer to this, and I actually would be more interested in your answer than my answer in this. Steve, seriously, do you have a thought? I mean, what do you think about that tension?
Well, I think you're in the right direction. There's a lot more thinking, I think, on the legal and construct side of the exceptions.
Yeah.
Modifying that in advance. But this, we know from everything from credentialing issues that have to get sorted out in advance. The medical area is obviously a key one, though, because you really are having to move into that direction. And anything that relates to safety issues has to have these caveats built into it, and locals need to know. Those firemen and police shouldn't be frozen in place because they're following the rules, and then they become barriers.
When I was down here after Katrina, in the initial few days, there were a lot of people walking around with stethoscopes who identified themselves as Dr. Smith, who were, whatever, but a lot of them not actually physicians. And is that the kind of rule breaking we want? That you could just kind of put on a doctor's costume and go out there and, treat people? So we have to find that balance, and it's tricky.
Okay, we're going to do one more before the break. Go ahead.
Good morning. I'm Laura Hernandez from Ventura County, California. Our county neighbors Los Angeles, and we're actually are doing planning in the area of mass convergence from Los Angeles County due to an IND and other scenarios. Based on your studies, how much percentage do you attribute to those who evacuate spontaneously versus under the direction of officials?
How much?
What's the percentage of evacuees I'm sorry, seriously, Jack Lake. How many people do you attribute to evacuating spontaneously on their own versus evacuating under the direction of an official? What's the percentage, if you know?
Well, it's extreme. I don't have a percentage because it's extremely variable. If there was a nuclear detonation in Manhattan, we'd have highly uncontrolled evacuation. If we're talking about 3 days warning for another big-time hurricane, you could expect much more orderly and controlled evacuation. And then there's everything in between. Probably many of you in the audience would have opinions of.
I
of this question, but what do you think? I mean,
I'm thinking of as an IND.
yeah.
And what's the official posture? Is the official posture for people to direct people out, or is your scenario based on people evacuating spontaneously because of the fear of nuclear
Yeah, well,
exposure?
the current guideline is shelter in place. This is for an IND,
Right.
for a period of time, and that period of time would ideally be directed by particular conditions, and then you leave the shelter in place situation, and then you get out of town, but you have to go in the right direction out of town, so you're not, going under the radioactive cloud. But the details of this, the reality is that without a lot of education of the public, we're going to have a lot of people who just are evacuating anyway when they shouldn't, staying in place when they shouldn't do that either. So I don't know. I know you have pretty significantly sophisticated planning inventory. Is that where Bob Levine is?
Yes,
Yeah,
that's my
okay.
public health officer.
Yeah. In fact, he was at our Day 3 conference a couple years ago. But you have to kind of get into this to try to figure out what would be ideal, and then how do you educate the public and the officials to make sure that we're getting as close to that ideal as possible. Why? All for one purpose, is to try to maximize survival and reduce fatalities and injuries from whatever the event is. So, I don't know, it didn't exactly answer you, but these are things that you have to get into in great detail on your local and regional planning basis, which I think you are.
Thank you.
Yeah, well, and another suggestion too, Dr. Jay Baker from Florida State is somewhere in the audience, I know, and he could certainly answer that from the perspective of hurricanes. I don't think anybody knows as much about evacuation, spontaneous or otherwise, from hurricanes as Jay, so you might want to find him up too. So, Blair, I think we're out of time, unfortunately, but thank you again. It was a pleasure to have you. And